All right, so welcome everybody to today's teleconference/webinar presentation. We are really excited about all the interest in our market intelligence work stream led by Francois. Today we'll be hearing more information about the survey that they recently conducted to find out more about how data is being used in the reproductive health program. So I would like to turn it over to Francois to go ahead and get started.
Good morning. Can you hear me?
Yep, we can hear you great.
Great. So good morning, everyone, or good afternoon, good evening, whatever time it is where you're calling from or joining from. So this is normally a meeting of the Market Intelligence Workstream to discuss the activities that we're involved in. But this time we decided to invite more people to join. It's always an open invitation, but we wanted to make a special effort to signal to folks that we're going to report out on the survey that we conducted on the use of market research in reproductive health. We also did this because the people who responded to the survey very nicely, for the most part, said that they wouldn't mind being contacted. So we thought we'd involve you all in understanding the results of this survey and thinking of next steps together. So all right, I'm having problems moving this presentation forward.
Francois, it might work if you try to just click the slide or hit the arrow buttons. Okay.
Oh, for some reason it is not working. Sorry, everybody.
It's okay. Try.
Here we go. Okay. We got. Yeah. I tried something different and it worked. One arrow. So just a very quick overview of what the Market Intelligence Workstream is doing. We're a work stream under the Market Development Approaches Working Group of the Reproductive Health Supplies Coalition. This work stream was designed to look into what we felt was probably an unmet need for accessing reliable market data. And therefore, what we're going to try to do, the first step that we decided to undertake was to find out from folks in the reproductive health community, basically the RHSC membership, which is quite large. We sent out a survey to try to understand how people are accessing research data and what they're doing with it, market data specifically. Sorry. So we did this in December. We designed the survey with the help of the Market Intelligence Workstream group, which is not very large. Other people also helped out from the different organizations that are involved in this workstream. And what we got was we got responses from 104 people, which is pretty good actually for a pretty long survey actually. So we're really grateful for the people who took the time to respond to it. So what we're going to present is basically the reasons, what organizations use research for, how they access it, and what challenges they experience. We also solicited some ideas on how to address those challenges. And what we'll do with these findings is work together within the work stream and with anyone who's interested in contributing to this effort, try to come up with solutions, some strategies that will help people access market data. So this is what we found. So we got respondents from about 42 countries, We got a lot of respondents from Latin America and a lot of respondents from Africa, as well as from the US. As you can see, they really belong to different types of organizations across the public and the private sector. We even had 10 manufacturers, which was very interesting because they have a bit of a different point of view. A lot of local NGOs, and then of course some bilateral, multilateral agencies and foundations. So a very interesting and varied group of people. Sorry, I'm having trouble moving this thing. All right, sorry about that, but I am not able to move the presentation forward. Alexa?
Hi, if you hover to your bottom left, I think there were arrows there.
Bottom left? I actually cannot see it.
Yeah, right there.
Oh, say, okay, bottom left, got it. Okay, sorry about that. Most of the respondents were actually involved in program management, which encompasses a lot of different activities. But these were people who were really looking to inform their programs, so not just research for the sake of research, although that's good too. Most respondents, so these are actually numbers of people who responded to the survey, most had used market data in the last 5 years. So I was a little surprised about that. More than half actually, or nearly half, used it routinely. So once every quarter, looking at market research data. 42 did it occasionally, and very few people actually never used it. So you're going to tell me, well, this is biased because only the people who have an interest in market research and who use it are likely to respond to this survey. So I accept that. So we're definitely looking at people with an interest in research. So these are the broad categories of responses that we propose to find out generally in what categories people fall in terms of their need for market data. As you can see, it depended on the region. Latin America is really looking for data to measure the impact of their activities. That's also true in sub-Saharan Africa. But there's a lot of use of research also to even inform the design of a program, to figure out the right way to address the market. I was a little bit surprised to see that actually people tend to look for data, a lot of different types of data, and not just private. When we sent out the survey, I thought we were going to get a lot of people who were primarily looking for private sector market data. The notion of markets may suggest that, but no, people seem to think of market data as being both public and private. So for example, 68% of the respondents collected data to figure out what commodities are provided to clients for free at public health clinics or through NGOs. So this notion of finding out what's actually handed out for free is considered part of market data, and it is. Initially, when we came together as a work stream, we felt that there might be a particularly acute need for market data in the context of a total market approach. Because it is true that if you're trying to develop programs that are supposed to, that are thought through at the whole market level, you need to understand all of it, and preferably quantitatively. Otherwise, it's very hard to figure out what is the role of the private sector, in this overall marketplace, and same for the public and NGO sector. But that's actually not why most people look for market data. They really look for market data for to figure out demand, to figure out whether people have a need for products, for reproductive health products, because we did focus on products here, or services, and whether the supply actually meets that demand. So it's really fundamental need to understand whether there are enough products, if they're the right products, and whether people are accessing them. And pricing is a big component of that. Actual availability is a big component of that need. So it seems that most people try to access market data through publicly available sources. So it could be statistics, but there's definitely, and we'll see further down in those results, that people really don't want to have to pay for this. So they're really trying to get it for free as much as possible, and they really do expect for data to be publicly available. And many conduct key informant interviews. I know that our organization, Apt Associates, uses key informant interviews a lot of the time when we're doing market assessments, I call them, because quantitative data can be very difficult to access, specifically for the private sector, but also for the public sector. So we do a lot of interviews to try and figure out, you know, who's doing what, which products are available, what are their prices. So a lot of it is basically trying to get a sense of the market through qualitative interviews. As you can see, very few people, a very small minority of respondents actually hired market research firms or purchased the data from a syndicated survey. And if I had to guess, I would say there are people who work for these pharmaceutical companies, because that is part of their day-to-day business. It's really knowing, you know, what the market looks like in terms of market share and who's selling what. So what was maybe the most interesting aspect of the survey is where people are finding their information, where they look for data. Ministry of Health comes up a lot. A lot of studies that are actually conducted by donors or with donor funding, sort of public services that are supported by an organization, for example, the RH Interchange. There's also supply chain data that can be obtained from publicly supported projects. Social marketing data, which is accessible over the internet through the DKT website. So there's a lot of different sources there, and it's actually part of the effort that we're going to try to undertake going forward is how do we sort of consolidate somewhere in one place where information can be found about markets, particularly quantitative. So as I said earlier, very few organizations, very few individuals in this survey said that they were conducting their own data collection. Those who did basically conducted the survey to figure out the volume of products available or sold and the value of those products. Some organizations can conduct distribution surveys. They're also called retail audits to basically try and figure out what's in the market at what price, what stock levels might be, and what the different market shares might be. Social marketing organizations tend to do this a lot, as well as of course, commercial organizations that have the resources to conduct these surveys. So, but it is a minority. So if there's anything that emerges from this survey is that these organizations, these individuals really say they tend to struggle. There's lots of challenges out there in obtaining data, particularly obtaining reliable data. So this confirms the initial discussions that we had as a work stream. That is really hard to find reliable data. You can find data, you can find information, you can find things that are qualitative, things that are possibly and often outdated, 5 years old, 10 years old. And when you're looking at markets, they change so quickly that it really needs to be recent data. So that seems to be a big problem. Most respondents say that they have a hard time finding reliable commercial data, data from the nonprofit sector, which really shouldn't be that difficult, and same for the public sector. So these are the most salient challenges. The other one, that's the other blue bar here, is the cost of obtaining data. So if you want to purchase data or collect data, it can be really prohibitive for many organizations. And this actually shows how much people are willing to pay, or how much organizations are willing to pay. It's actually very little. When you think that a survey, a retail audit in, say, sub-Saharan African country might cost you about $100,000, that's very, very few respondents are willing to actually pay this much for a survey. So that's a concern, and the majority actually would pay nothing or less than $5,000. So we also asked for possible solutions that people could come up with as part of the survey. These are sort of the high-level responses that we got. There's definitely a sense that it should be available, right? That it's a public good, information is a public good, should be available, particularly when it's collected by the public sector. So there were some suggestions that, you know, we should advocate, we as a community should advocate with governments so they make public sector data available more readily. For example, distribution of free commodities, this should be clearly communicated, stockouts, all the things that help you figure out what the public sector is doing. Quite a few respondents who volunteered solutions, so that was not the majority, I should say, but those that did volunteer ideas said that we really need to make an effort to coordinate across organizations within the same country, and I assume also at the global level, but within the same country. This suggestion came a lot from Latin America, the sense that there are many of us who need this market data. Can we get together and try to coordinate between amongst each other, and can we even join forces and mobilize resources so we can together perhaps buy market data. Also get together to try to obtain preferential prices. If this is something that we do regularly, can we try to negotiate with research firms so they give us, you know, a better deal? There was also a call for technical assistance for the reproductive health organizations that need market data and may have to collect it and don't really know how to do it because they're not well versed in market research. Market research is different from the type of research that we tend to do a lot in reproductive health, which is demographic research. So there was a call for that. And then I have to mention this last one. And more than one person, so a handful of people said that they felt that private entities should share their data, that it should be mandatory. I'm not sure it's quite feasible, but it was definitely a thought out there. So just to summarize the survey, and then I can open this up for questions, and we can discuss a little bit where do we go from here. So it turns out from the survey responses that most of these respondents reported that they have a need for market data and that their need really encompasses the whole market. So most have experienced problems accessing reliable data, accessing affordable data is difficult. It's maybe that is the biggest challenge. And the key suggestions, as I described, include advocacy to try to get better and more readily available public sector data, pooling resources, and technical assistance. So this, in a way, points towards some potential next steps for our work stream. So I'm going to stop here, and Alex, can you open up for questions so that we can go through these questions and maybe have a little bit of time towards the end to discuss how the workstream can, can devise some next steps and maybe see who might be interested in helping us do that.
Yeah, hi everyone. This is Andrea Baer. Francoise, thank you so much for the presentation today and for really initiating this effort. And we have a good round of participation on the call today, and I think you got great participation in the survey in terms of the number of responses. So really appreciate that. And I'm sorry if I jumped in too soon before you were going to, cover your acknowledgements page.
No, I'm sorry, I forgot about it. So go ahead, I shouldn't have opened it, but I'll do it very quickly. Yes, I have to really give full credit to Alexa Smith-Rommel, who's on the call, who actually processed the survey responses, designed the survey, processed the responses, and actually developed the report that I used to make this presentation. So Alexa, thank you so much. The other contributors were mostly from the RHSC. They have done a great job helping us really figure out what the next step should be, and they've definitely helped a lot with this survey. I also want to thank Milka Dinev, who did the Spanish translation. This survey was done in 3 languages, but we needed help with the Spanish and translating it in Spanish, and Milka did a great job. Andrea, you helped us with your inputs. Denise Harrison also provided some inputs on the survey, et cetera, et cetera. And Anita Deshpande is actually my co-lead. Okay, so I'll stop here. Thank you to everyone who contributed and is calling today. So over to you, Andrea. Sorry about this.
No, that's great. Thanks again, Francoise, and to Alexa, obviously, their app, and others who really helped make this happen. So at this point, let's open it up for discussions and questions and also discussion. And so you can type in questions and Alex or I can read them out, but also welcome people to just unmute and state your name and what organization you're with and ask a question or make a comment.
And also, this is Alex. Just a quick note. If you are, I'm unmuting everyone right now. If you're not speaking, can you mute yourself?
So this is Andrea. Again, while people are thinking about things, one of the points that I thought was interesting, Francoise and everyone, was, and I forget which page this was, Francoise, but when the survey asked about challenges, right, and talking about the lack of reliable data, and that, and you had the responses for commercial, nonprofit, and public data. And one of the things that I thought was interesting, and I think we may have a couple people on the line who, co-led possibly or were involved in the recent family planning report, which focuses more on the manufactured data and the public sector, is sometimes I wonder, I think it was another slide, Francoise, it was one about problems or what the challenges were, where it talked about lack of reliable data. Yeah, that one. So one of the things I wondered here, and it's maybe a question for the group, is sometimes whether it's a question of people's awareness. And I suppose I'm thinking most specifically about, the recent report that was sponsored by RHSC and presented just about a week ago. So I don't know if others have thoughts about that if in part, clearly there's a lack of data, but also in some cases, if it's a matter of just awareness of what data does exist. Francoise, do you have thoughts about that, or does anyone else?
Yeah, well, I actually think that people don't know where to find data. I don't know where to find data. I use market data all the time. I don't always know what's available, especially at the country level. So there is no clearinghouse for this. So it wasn't specifically addressed. I think somebody needs to mute themselves. But that's definitely an issue.
Hi, this is
Okay, thanks.
Flash question.
Yeah, go ahead.
Okay, I thought it seems like based on the research you presented, and thank you very much, Francoise and the team. This is very nicely done and very helpful. It seems like there's a quandary, and I was just wondering if there are suggestions on how to get out of it, in that it shows that most of the respondents are interested in finding out, you know, how public sector commodities are being consumed and distributed, and if people have to pay for them. But at the same time, they want this data to be free, I guess, because it's the public sector. And they say that they want, we should be advocating for the Ministry of Health to make this data for free, or make this data public. And I think actually, just to put in a plug for Guatemala, I think Guatemala has done a really good job on this. But I'm just wondering, Francoise, if anyone gave you suggestions on how to do that, because I think that's what we do all the time. And I can say, being in the group that works with GHSC PSM, you know, being in the CSL at USAID, we really look more at stock outs. And I do think there might be a role for RHSC to look more in terms of public data, public sector data at consumption, but usually the ministries of health don't want to make that available. So anyway, I guess that's kind of a confusing question. Did people make suggestions on how to resolve this? Because it seems like it's something that we do all the time, advocate for more transparency with the Ministry of Health. People don't want to pay because you could get a private company to go in and kind of collect that type of data. And I don't know, we're kind of stuck at where we are now. Anyway, sorry for the confusing question.
No, I mean, I think it makes sense. It's what we're all wondering. You know, this was a survey where there were some open questions. Most of the open questions were, you know, what are the challenges you experience, or what have you done to address this problem? But I think you raise a very good question, which is it is a quandary. If people don't want to pay for data, then that means we need to find free data. And if the public sector is not willing to make data available, then we need to advocate for it, right? Okay, so how do we do that? Sorry, can other people mute themselves because I can't hear? I think those are two different questions. There's the public sector's availability to make data available that they have. And then there is commercial data that is normally something you have to buy unless, you know, the different private sector actors are willing to share their data, which sometimes happens, but often doesn't. So for the private sector, I think we might think about ways, and some of these suggestions point to that strategy, is get together, figure out what we need. Every organization does not need to have the level of detail that you would get from a retail audit. For example, what product is found in which particular district at what price, and do they have stockouts? You know, most people are not looking for this. I think that most organizations are looking for a good sense of what the market looks like in terms of market share, you know, average prices or ranges of prices, but just some basic information so that they know whether, and then they can actually compare that to the performance of their own products or own activities. So it may be possible, I don't know if there's a researcher on the call, it may, I mean a research company, it may be possible to negotiate publicly available information that can be aggregated, analyzed, and then made available at the aggregated level, a very overarching level. You see that in some consulting firm market reports that are actually publicly available, and you can see that they have used actual market data. They're not divulging that. So the issue that IQVIA would have, for example, if we were to buy data from them and then share it with everybody, is that nobody else will ever want to buy this information at that level, right? The aggregation of data into a report that is meant for public consumption, I think, is not an unreasonable goal. And that's why the suggestion from the respondents that said, let's get together and address, you know, what the need is and see how together we can figure out a way. I think that's very smart, actually. So that addresses the commercial sector data. The public sector data is a different discussion, but it might have to do with having the proper systems in-house to be able to collect, report, and share. And those of us who work in supply chain area know that actually collecting and reporting is tough within the ministry. So if the ministry can figure it out by strengthening those systems, they may very well be willing to share it. So that's my grain of salt when it comes to public sector. Sorry, it's a long answer, but it's a complex issue.
Can I just comment on that real quick?
Sure. Yeah, go ahead, of course.
Going back to the public sector piece, I don't know if Anita's on the call, but you know, this is a huge project, PSM, and the focus is really on stock levels, and I think that's oriented the whole community on stock levels and stock out. RHSC has a lot of stock out initiatives, et cetera. There's a lot of money going behind that. And to the survey's point, I'm just wondering if the community was more, maybe not equally, but a little bit more oriented towards tracking the consumption data. Because, you know, the stock out data, that's a very sensitive, you know, data point, and we're all working to make that more public. And I'm just wondering if it also makes sense for the community to emphasize consumption. I mean, just based on what the survey is saying, Francois, because there's so many, you know, meetings and papers on stock out. Stock out is very important, of course, but you don't see a lot on the consumption reports, which it seems like your respondents were interested in getting.
I think we lost you, but I think it might help to look at this slide. It's showing where most of the respondents hailed from. There were a lot of people working for NGOs, and we had a lot of respondents from Latin America. I think NGOs in Latin America need a specific type of information in order to be able to measure how well they're doing with their programs. They're also in more developed markets where the commercial sector plays a much bigger part, so they're probably having trouble accessing this. So the stock outs, I don't know. I think if we had more people coming who responding who work for the public sector, then we might see that concern, you know, emerge more often.
Hi, Francoise. This is Chris Brady. How are you?
Good, thank you. Hi, Chris.
Calling in from Pakistan. So late at night here, but I really enjoyed your presentation. Thank you. I just had one quick comment and question, I guess, is that basically, you know, when it comes to USAID or US research and market research in particular, you know, I often look at the USAID deck and, you know, with the hope that I'll find something relevant to what I'm investigating, and I find it just really outdated. So many of the reports, it's just not really kept up. And I'm thinking, you know, that's a very concrete thing. Maybe we can make a request that more effort goes towards keeping the reports and all of that fresh.
Yes, definitely, and that's an even tougher call because if we imagine that we could have sort of a clearinghouse where someone's collecting information, turning it into some sort of report, and then disseminating it, keeping that current, keeping that regular, it is a real challenge. It requires funding, basically. So I think maybe annually is probably the most we can hope for in terms of reproductive health organization, as a writ large, like the overall need out there. Annually I think would be good and feasible. Quarterly, monthly, I think would be very difficult unless we have a system where there is access into a database that consolidates data from different mostly public sector or NGO sources, though. But so much of it is voluntary, the act of providing information. So anything that's free has some element of either donor support or government support or voluntary submission of information. It's a bigger conversation, but what you're saying also captures what we all think and what I think a lot of the respondents alluded to, that the data they access is not of very good quality. So it's poor quality data, it's outdated, or it's incomplete. Incomplete data was mentioned. So this is not an easy, simple, issue to address. But thank you for this.
Sure. Yeah, I think it just also comes down to just policing the requirements of submitting the reports and such on a regular basis.
Right. So at the country level, that's where we get the most calls for, let's make the government do this, let's make the private sector do this. So the policing, of course, can only happen at the country level. I don't think we can police the world. But yeah, there are some countries where that might actually be quite feasible. Others are much less so.
Thanks.
You're welcome.
So this is Andrea. So one question that got typed in from one of our participants was in regard to potentially getting the survey results in Spanish, which I don't know that we have that easily planned to do. But I don't know if you have any comments on that, Francoise.
So, so the report that we have is actually not necessarily something that we're going to be able to disseminate. It is. We have the slide deck. We could potentially translate the slide deck. The actual report actually would require, quite a bit of time to turn it into a report to disseminate. So we have to kind of figure out how the Workstream would support that. The purpose of the survey was really to inform the activities of the Workstream. So now, as a Workstream, we have to decide: do we want to put more resources into taking this report, taking these data, turning them into a report that will then be disseminated, or do we want to now concentrate on figuring out solutions and putting more efforts into that, and more resources into generating the guidance that we had discussed originally? So we said, for the benefits of the respondents, of the people who are on the call, we said we were going to do this to find out whether our intuition that there was a need for better market research out there was correct, and then from that figure out what the solutions might be, what we might be able to generate, mostly in terms of a white paper, a guidance on where to find data, how to do market research, how to do what's really needed in terms of data, and how to find it, affordably. So that's a tall order as it is. I think finding solutions is going to be, a group effort. Now, if if there is a consensus that we really need to disseminate what is essentially an expression of need and even frustration at some level, we can do that. I mean, this is something that we can discuss as a group.
Yeah, thanks, Francoise. And I think it also draws home that as we move forward in the work stream, what's most important, one of the things that's really important is that we stay cognizant of the need to stay in touch with our Latin colleagues and Francophone Africa, and do, to the extent possible, capture our communications in Spanish and French as well, to your point about really focused on what do we do next and how to potentially work on these challenges. So I think it was a great question from the caller. So I think maybe Kim Longfield has a question that she'd like, or a comment and a question she'd like to make. So Kim, if you're on and you want to unmute and speak.
Sure. Thanks, Andrea. I wasn't sure of the protocol, so thanks for looking at my question. Thanks, Francoise, also for a great presentation. And my question was actually just like Chris's, this idea of the lift of cleaning and getting data ready for public consumption, and maybe that's the problem, because I was curious about this finding, that there's a lack of reliable data from the nonprofit sector. The other thing I'm wondering is, maybe that also gets at the idea of less demand side information being available, because there's a lot of supply side information that's being used and looked for, but maybe people don't know how much good consumer insight could be out there because organizations don't have the time to clean it and prepare it for external consumption.
That's a good point, and actually, thank you, Kim, for that comment. We're one of the organizations that produces reports that are not really cleaned up for public consumption. So, like every other organization, we have our deliverables that we make available, but we have information. Other organizations have information as well. NGOs. Collect information. PSI collects an enormous amount of information, but doesn't necessarily have the resources to turn them into public consumption products. So that's another facet of this question, is that there's a lot of information out there, and actually some of it might be shareable, but it needs to be it needs to be presented in a way that different organizations can benefit from it, and it needs to be you don't want to open yourself up for criticism because your research is deemed not sufficiently tight or reliable. So that's another issue. But thank you, very good point.
Thanks. The other thing, and not to jump to solutions, but this gets at what Chris was saying about the deck. The deck is restrictive at the same time that it's demanding. And so, there's not enough information. You can't put the flesh on the bones, really, on the information that's required to be in the deck. So people can't, if they're going to it cold, they don't know how to bring information together and maybe even use it in a new way. But I wonder if there might be a solution for presenting carrots or competitions or insights or some other lighter way to get people to share their insights, so they're not doing what you just said, opening themselves up for criticism on their research, or maybe people wanting to answer a question they never sought to answer themselves.
Agreed. If we don't have other questions, I might actually propose this idea that, as a work stream, the best thing we can probably do is draw from the collective experience to come up with a guidance note, a guidance paper that will figure out basically the most used sources of information, what they give you, what you can expect from a particular source. Ideally, it would have to be done at the country level, but you could have something that tells people, if you're looking for information about the private commercial sector, you can go and ask them because sometimes they will give it to you, actually. In some countries, I've been surprised recently to see that distributors are actually volunteering their sales data. So what do you know? But then you can buy it. This is how you go about doing it. You should know these are the average prices that you might pay for a survey. You can try to get it from a social marketing organization that does its own research. They might be able to share it at the aggregate level. So I guess what I'm trying to say is to provide perhaps like those of us who use these sources, and I don't know all of them. I don't know if any of us actually knows all the potential sources of data and market information, but collectively we can try to actually come up with a nomenclature of market data sources, you know, with various level of quantitative reliability, maybe pros and cons, limitations, cost consideration. This is the thing that comes to mind after you do a survey like this one. You realize there's a need, but then maybe collectively we can find solutions to this need. But this will require a certain number of, you know, volunteer members who have experience in collecting research data, and even some research firms that I hope might be able to assist us, you know, in developing this. So that is my big idea. It's not very imaginative, but if others have ideas for, you know, helping people out basically as a work stream, we can also disseminate what we know here to more members. There are about 30 people on this call. We could also make it a point for the work stream to disseminate these findings as a way to advocate with governments and donors, I mean all the organizations that are able to help generate the data or support an effort to make the data accessible. So those are my thoughts, but I'm going to stop now and let others opine.
Francoise, this is Andrea. We got another question typed in from Stephen in Senegal, and I'm not sure what organization he's with, and we'll see if I can capture his question accurately. But I think the question was regarding insights on the quality of information that people may get from the public sectors, i.e. from the Ministry of Health. So I'm trying to capture that from a written question, but if you have any comments, I'm sure the person would be happy to hear.
This reminds me of a comment that Denise Harrison had made early on when we were having our first meetings. She said, we know the reliable sources of data. There are, you know, there are sources that are deemed reliable, and that's something we can share. Our understanding of where you can be sure the data is going to be very reliable. You know, I'll cite the DHS, for example. We cannot fix everything, certainly not a work stream like us, but we can point people in the direction, in the right direction for finding reliable information. So we could, and it is a value judgment, and we have to manage this carefully, but we could point to some sort of, you know, globally recognized sources of information that people can trust. The quality issue is huge because I don't know if anyone is on the call from MyQVI, but they would tell you, and you get what you pay for, and I completely agree with them. To produce quality data, you have to spend money. You have to clean it. You have to do your sampling correctly. You have to have people who know what they're doing. We constantly run into issues, even with reputable research firms, on the quality of the data that is collected. It's probably a separate question altogether that as a work stream we can address. What are ways to maximize the quality of your survey? Now, if the question is about how do I know that the data I'm getting from a source is going to be quality data, you don't, other than knowing whether this is a recognized, reputable source of information. I mean, I understand that that's an issue, but we need to think about as a work stream how we can help address that. But again, it's a collective effort. if anyone on this call or in the workstream thinks they have a good idea for addressing this question of quality, we would love to hear from them and maybe make that the topic of one of our subsequent calls.
Hi, this is Denise. Can you hear me?
Yes, yes, Denise.
Okay, yeah. Was Steve's question about quality public sector data or market data in general?
Stephen had just typed in public data.
Okay, data that's made available public. Okay, so my comment was on public sector data.
Yeah.
Okay, that's it.
So actually, this takes us back to the question of helping perhaps the ministry come up with a better system. It really suggests system strengthening internally.
All right, so we don't have any more typed in questions. I know that we just have about 5 minutes left or so, and I want to definitely invite anyone to chime in with thoughts on potential solutions, and certainly to express interest in helping to generate solutions. I think we have nibbled around the edges of some of them, but is there anything that anybody would like to jump in with at this point? Or Francoise or Denise, with regard to solutions, is there a specific question that we'd like to ask the group?
Yes. So I guess a question for the group, specifically the people who called in today, and I know they're not all part of the workstream. If you have any suggestions on how we could, as a workstream, address the issues that were raised today, please just email us. I think maybe Alex can suggest the best way to email suggestions for the workstream. But if we know what you're all thinking, we can maybe try to make our next call about those next steps. If you're interested in supporting it, perhaps in a very modest way by reviewing something or by sharing some of your experience, if you've had success with particular sources of information, we can also send a few questions to the people who attend the call. I don't know if we're able to see this, but basically we do need feedback. So any feedback you can provide to help us on the next steps. If you're interested in helping develop this guidance that we're thinking about producing, those are going to be the topics of our next call, subsequent calls. And again, everyone is welcome to join our workstream call, even if you're not. We don't actually have formal members, but anyone is welcome.
Yeah, that's great. Thanks so much, Francois. This is Alex. The best way to reach us would be to join our listserv, and then you can directly write into that, and it will go to everybody who has signed up to be on the listserv. And you can do that by going to rhsupplies.org, and you'll be able to find a link on how to join our different implementing mechanisms and work streams. And if you're having trouble with that, feel free to email me directly. My email is a.mcdevitt@rhsupplies.org. You will have received it by registering for this webinar as well.
Thank you, Alex.
Yeah, and so I can comment a little bit more for Stephen, who's not able to speak directly on the line. But Stephen responded and said, thanks for the response. Still interested in better understanding and sourcing data, whether it's from public or private sector. And then his question really is, how can we know that the data are valuable? From what source and what criteria? So You'll certainly want to comment on that, Francoise, but I think this is reinforcing in one part this need that people are expressing for like just understanding what are the sources and some sort of quality assurance. And I think that may be a challenge for us, but it definitely raises an interesting point. So over to you, Francoise.
Right, and I really think that we can probably come up with a list of sources of data that are considered really reliable year after year. I mean, I'll cite, and I'm sure there might be criticisms of that because who knows, right? But I think the DKT International's list statistics of sales around the world is very reliable. I know how they collect the information. So that's just one example out of many. So I think we can really focus on that. It's a problem, and we can. It will be a judgment call, and we have to see, you know, how we manage this. But I think we need to go there.
Thank you. All right, so just a couple of minutes left, and you're definitely getting lots of appreciation, Francoise, for doing this from myself, and Milka and others are writing in, very appreciative of the effort here. Just with a minute left, is there anything else that people want to chime in with? Or Francoise, do you have any final points?
Let's see if people chime in. If not, I am happy to wrap up. Okay, so I think I'll wrap up. Well, first I want to thank all the folks who responded to the survey, and I know probably a lot of people called in today were people who had contributed to the survey. We really appreciate that. We're going to regroup and as a work stream, try to figure out how we can help within the limitations of a work stream activity. But I think I think we can do something. We will communicate about what the work stream intends to do. I do need the current members of the work stream to make sure they attend the next call. And anyone else who's interested in contributing or has an idea or just wants to find out what we're going to do, again, to please participate. This is how we're going to figure this out. It's a collective answer to what appears to be a pretty widespread unmet need here. But thank you for calling today, for joining today. And thank you, Andrea and Alex, for helping us with helping me go through this presentation. I wasn't very familiar with the system, so I really appreciate your help. So I think this concludes our call, our virtual meeting. I look forward to seeing as many of you on our next call. Thank you very much.
Thank you.
Thank
you.
Thank you.
Hey, bye all.
Goodbye.